Explain what PCOS is and its impact on fertility. 3. Consult a specialist. Point out the importance of seeking advice from a fertility specialist or gynecologist. 4. Lifestyle changes. Discuss the significance of adopting a healthy lifestyle, including a balanced diet and regular exercise. 5. Maintain a healthy weight. Highlight the connection between weight management and PCOS-related fertility issues. 6. Monitor ovulation. Explain methods for tracking ovulation, such as using ovulation predictor kits. 7. Timing intercourse. Offer guidance on the optimal timing for intercourse during the menstrual cycle. 8. Fertility-friendly diet. Suggest foods that may positively impact fertility for women with PCOS. Non-productive health. 10. Reduce stress. Discuss stress management techniques as stress can impact fertility. 11. Supplements. Introduce supplements like folic acid and inositol that may support fertility. 12. Medications. Briefly mention medications that may be prescribed to regulate ovulation. 13. In vitro fertilization, IVF. Touch on the option of assisted reproductive technologies like IVF. 14. Acupuncture. Mention studies suggesting acupuncture may aid fertility in women with PCOS. 15. Regular checkups. Encourage regular checkups to monitor progress and adjust strategies if needed. 16. Partners' health. Remind that male fertility is crucial and partners should maintain their health. 17. Educate yourself. Encourage women with PCOS to educate themselves on their condition and fertility. 18. Community support. Recommend joining online communities or support groups for sharing experiences. 19. Patience and persistence. Emphasize that the journey might take time and persistence is key. 20. Closing. Conclude with a message of hope, reminding viewers that many women with PCOS. Balancing act. A guide for pregnant working women. Managing work while being pregnant can be a manageable experience. Here are some tips for pregnant women who are also working. 1. Communication with your employer. Inform your employer about your pregnancy in a timely manner. This allows them to make any necessary adjustments and accommodations. Discuss your plans for maternity leave and ensure you understand your company's policies regarding pregnancy and parental leave. 2. Schedule regular prenatal checkups. Attend all necessary prenatal appointments to ensure the health of both you and your baby. Communicate with your employer about these appointments in advance and discuss any necessary time off. 3. Flexible work arrangements. If possible, explore flexible work options such as telecommuting or adjusting your work hours to accommodate your changing needs and energy levels. 4. Take breaks and rest. Listen to your body and take breaks when needed. Short breaks can help alleviate fatigue and stress. Ensure you have a comfortable chair and workspace to support your changing body. 5. Stay organized. Use tools like calendars, planners, or apps to stay organized and manage your workload efficiently. Prioritize tasks and focus on what's most important to reduce stress. 6. Delegate tasks. If you have the opportunity, delegate tasks that can be handled by others. This can help lighten your workload and reduce stress. 7. Stay hydrated and eat well. Proper nutrition is crucial during pregnancy. Stay hydrated and eat balanced, healthy meals to maintain your energy levels. 8. Seek support from colleagues. Let your colleagues know about your pregnancy, especially if it may affect your work in any way. They can provide support and understanding. Remember, it's essential to prioritize your health and the health of your baby during this time. Don't hesitate to communicate openly with your employer, seek support from your colleagues, and make adjustments as needed to manage the demands of both work and pregnancy.
The size of the fetus at 16 weeks pregnant. At 16 weeks, your fetus is now the size of an apple. Your little one could be more than 4.5 inches long, crown to rump, and weigh close to 4 ounces. How big is my baby at 16 weeks? Your baby now weighs in at a whopping 3 to 4 ounces and is 4 to 5 inches in length. The backbone and tiny muscles in your baby's back are gaining strength, so she can straighten out that head and neck even more. Thanks to those developing facial muscles, your baby is capable of making a few expressive frowns and squints, even at this early stage. Baby's beautiful eyes are finally working too, making small side-to-side movements and perceiving light, although the eyelids are still sealed. Delicate baby skin. Your baby's skin is thin and translucent. It will thicken and develop as your pregnancy progresses, but will continue to be almost transparent for quite some time. And here's the skinny on baby skin, it's practically translucent now, so if you took a peek inside your uterus, you'd be able to see your baby's blood vessels under that thin skin. Scalp patterning. On your baby's scalp, hair follicles are forming a pattern that will remain for life. This patterning sets the stage for how your baby's hair will grow. New hair follicles don't form after birth, so babies are born with all the hair follicles they'll ever have. Heart at work. Your baby's heart is now pumping about 25 quarts of blood each day, and this amount will continue to increase as your little one develops. Baby will soon hear your voice. Listen up, tiny bones in your fetus ears are in place, making it likely that baby will soon be able to hear your voice, or something like it, when you're speaking. Generally, babies fully develop the ability to hear in the womb by 18 weeks of pregnancy. During its 16th week of development, a fetus will be starting to form facial expressions, and its nervous system will be growing. Your body at week 16. Rapid growth. At 16 weeks pregnant, your uterus is growing at about the same pace as your baby's. It's getting to the point where you may not be able to hide your pregnancy anymore, even if you wanted to. Your 16 weeks pregnant belly. At 16 weeks, you may now be at the stage where your bump clearly has a baby in there. Your pregnancy weight gain. It may be hard to watch yourself gain weight during pregnancy, even when you know there's a wonderful reason for it, but try to embrace your body's new shape and think of every pound you put on as a sign of good health for you and your baby. Nasal congestion. 16 weeks pregnant, your symptoms. At 16 weeks pregnant, here are some of the symptoms you may be experiencing. Skin changes. You might have heard about the pregnancy glow, and now it might be your turn to experience it. Increased blood volume in the blood vessels and pregnancy hormones causing more oil production can make pregnant skin look flushed and dewy. Nosebleeds. At 16 weeks pregnant, nosebleeds can be an issue for some moms-to-be, and might be caused by increased circulation and higher levels of hormones. Lower back pain. This is one of the most common symptoms that can strike when you're pregnant, and it's good to have some strategies to avoid or lessen the discomfort. For example, take warm baths or showers, stretch regularly to help your hardworking back muscles relax, pay attention to your posture, and wear low-heeled shoes. Dizziness. Round ligament pain. As your amazing uterus grows, the round ligaments that support it are thickening and stretching. Breast changes. Pregnancy headaches.
Title: Effective PCOS Treatment, 20 Key Steps to Manage Polycystic Ovary Syndrome. 1. Introduction. Greet your viewers and provide a brief overview of PCOS. Mention the importance of early diagnosis and management. 2. Understanding PCOS. Explain what PCOS is and its impact on women's health. Highlight common symptoms such as irregular periods, acne, and weight gain. 3. Seek professional help. Emphasize the importance of consulting a healthcare professional for a proper diagnosis. Encourage viewers to find a healthcare provider experienced in managing PCOS. 4. Lifestyle modifications. Discuss the role of diet and exercise in managing PCOS symptoms. Suggest a balanced diet with emphasis on whole foods and regular physical activity. 5. Weight management. Address the link between PCOS and weight gain. Provide tips on healthy weight loss strategies, if applicable. 6. Medication options. Briefly explain common medications prescribed for PCOS, such as birth control pills and anti-androgens. Highlight the importance of medication adherence. 7. Nutritional supplements. Discuss supplements like inositol and vitamin D that may benefit women with PCOS. Emphasize consulting a healthcare professional before starting any supplement regimen. 8. Fertility considerations. Touch on the challenges PCOS may pose to fertility. Mention fertility treatments and options for those planning to conceive. 9. Hormonal balance. Explain how hormonal imbalances play a role in PCOS. Discuss hormone therapy options prescribed by healthcare professionals. 10. Regular monitoring. Stress the need for regular checkups and PCOS and sleep disturbances. 13. Skincare. Address skin-related concerns associated with PCOS. Provide skincare tips to manage acne and other skin issues. 14. Customized treatment plans. Acknowledge that PCOS treatment is not one size fits all. Encourage viewers to work with their healthcare providers to develop personalized plans. 15. Educational resources. Recommend reliable sources for further PCOS education. Mention reputable websites and support groups. 16. Community support. Emphasize the value of connecting with others who have PCOS. Mention online forums or local support groups. 17. Ongoing education. Encourage viewers to stay informed about new developments in PCOS research. Highlight the importance of staying proactive in managing one's health. 18. Mind-body connection. Discuss the impact of mental health on PCOS. Encourage practices that promote a healthy mind-body connection. 19. Long-term outlook. Discuss the long-term management of PCOS. Impact on overall health as women age. 20. Conclusion. Summarize key points. Encourage viewers to take a proactive approach to their PCOS management. Remember to tailor the script to your audience and provide accurate, up-to-date information.
Intro. Hey there, amazing viewers! Welcome back to our channel. Today, we have a topic that's close to the heart: pregnancy and self-care tips. Whether you're expecting, planning to be, or just curious, you're in for a treat. Stick around for the top 15 points that'll make your pregnancy journey a breeze. Point 1. Mindful nutrition. First up, let's talk about nourishing yourself and your little one. Opt for nutrient-rich foods, plenty of fruits and veggies, and don't forget that hydration game. Point 2. Gentle exercises. Next on the list is staying active, but no need for intense workouts. Gentle exercises like prenatal yoga or a simple stroll can do wonders for your well-being. Point 3. Beauty of rest. Ah, the beauty of rest. Embrace those power naps and full night's sleep. Your body and mind will thank you. Trust me. Point 4. Emotional wellness. It's okay to have mixed emotions. Prioritize your emotional well-being, whether through journaling, meditation, or just having heart-to-heart talks. Point 5. Pamper yourself, pamper time, treat yourself to a relaxing bath, a prenatal massage, or whatever makes you feel like the queen you are. Point 6. Support system. Surround yourself with positivity. Your support system is crucial. Friends, family, or fellow mom-to-be pals. Point 7. Educate yourself. Knowledge is power. Educate yourself about the beautiful journey you're on. Attend prenatal classes, read books, and absorb all the information. Point 8. Regular checkups. Speaking of information, regular checkups are a must. Keep track of your and your baby's health with those scheduled visits to your healthcare provider. Point 9. Fashionable comfort. Who says you can't be fashionable and comfortable? Invest in maternity, wear that makes you feel good and accommodates that growing belly. Point 10. Hygiene essentials. Pay extra attention to hygiene. A healthy baby. It's the little things that count. Point 11. Positive affirmations. Daily affirmations are like a power boost for your mindset. Remind yourself of the amazing journey you're on and the incredible mom you're becoming. Point 12. Create memories. Capture those beautiful moments. Whether it's through a pregnancy photo shoot or a simple diary, create memories that'll last a lifetime. Point 13. Delegate tasks. Don't be shy to ask for help. Delegate tasks and focus on what truly matters, your well-being and your baby's. Point 14. Stay flexible. Plans might change, and that's okay. Stay flexible and adapt to the beautiful. Point 15. Celebrate milestones. Last but not least, celebrate the milestones. Every kick, every ultrasound, it's all story. Outro. And there you have it, the top 15 points for a happy and healthy pregnancy. If you enjoyed this video, don't forget to give it a thumbs up, subscribe, and hit that notification bell. Until next time, take care of yourself and that precious bump. Sending lots of love.
Hello and welcome to our video on pregnancy workout. Being pregnant can be a beautiful and special time, but it can also come with its own physical challenges. In this video, we'll be talking about the benefits of staying active during pregnancy, as well as the potential risks to be aware of. Whether you're a first-time mom or a seasoned pro, this video will give you the information you need to make informed choices about your pregnancy workout routine. The advantages of pregnancy workout. Regular exercise can help you maintain a healthy weight, reduce the risk of gestational diabetes, and improve your mood. It can also prepare your body for labor and delivery, and help you bounce back more quickly after giving birth. Additionally, staying active during pregnancy can have long-term benefits for both you and your child. Studies have shown that children of active mothers are more likely to be active themselves, and have a lower risk of obesity and other health problems. Regular exercise during pregnancy can also help improve sleep, increase energy, and improve overall well-being. The importance of safety. It's essential to consult with your doctor before starting a new exercise program, especially if you have any pre-existing health conditions. Avoid activities that have a high risk of falling or injury, such as contact sports or downhill skiing. Listen to your body and make adjustments to your workout routine as needed. It's also important to stay hydrated, eat a healthy diet, and get enough rest. Modifying your workout. In the first trimester, you may be able to continue with your regular exercise routine, but as your body changes, you'll need to adapt. Reduce the intensity of your workout or avoid certain exercises as your pregnancy progresses. Prenatal yoga or water aerobics are both safe and effective ways to stay active during pregnancy. Prenatal Pilates and strength training are also great options to consider, as long as you are working with a trained professional who understands the modifications needed for pregnancy. The disadvantages of pregnancy workout. Some women may experience fatigue and morning sickness during the first trimester, which can make it difficult to maintain a regular exercise routine. As the pregnancy progresses and your body changes, certain exercises may become more difficult or uncomfortable. Some women may experience gestational hypertension or preeclampsia,
and in such cases, the doctor may advise to stop exercising. In conclusion, staying active during pregnancy can be beneficial for both you and your baby, but it's important to consult with your doctor, listen to your body and make necessary adjustments. Regular exercise can help you maintain a healthy weight, reduce the risk of gestational diabetes, and improve your mood, but it is essential to stay safe and avoid activities that have a high risk of falling or injury.
Title: How to Check a Pregnancy Test, a Comprehensive Guide. 1. Introduction. Welcome to our guide on how to check a pregnancy test accurately. 2. Importance of timing. Timing is crucial for accurate results. Discuss when to take the test for the best outcome. 3. Understanding pregnancy tests. Explain the types of pregnancy tests available, urine tests, and blood tests. 4. Choosing the right test. Guide viewers on selecting a reliable pregnancy test kit. 5. Reading the instructions. Emphasize the importance of thoroughly reading the instructions before starting the test. 6. Gathering supplies. List the necessary items needed for taking the test. 7. Collecting urine sample. Offer tips on how to collect a urine sample properly for the test. 8. Performing the test. Step-by-step demonstration on how to perform the test accurately. 9. Waiting period. Explain the waiting period before checking the results and why it's essential. 10. Interpreting results. Provide guidance on interpreting the results correctly, including what different symbols or lines mean. 11. False positives and negatives. Address factors that could lead to false positive or negative results. 12. Next steps. Discuss what to do after getting the results, whether positive or negative. 13. Seeking medical advice. Highlight the importance of consulting a healthcare professional for confirmation and further guidance. 14. Emotional support. Offer reassurance and support for viewers, acknowledging the emotional impact of pregnancy test results. 15. FAQs. Answer common questions about pregnancy tests, addressing concerns and misconceptions. 16. Tips for accuracy. Provide additional tips to ensure accurate results, such as testing in the morning and avoiding certain medications. 17. Handling results. Discuss how to cope with different outcomes and offer resources for support. 18. Partner involvement. Encourage involving partners in the testing process and decision-making. 19. Test disposal. Guide viewers on proper disposal of used pregnancy tests. 20. Conclusion. Summarize key points, reiterate the importance of accuracy, and offer encouragement to viewers. Step-by-step guide to in vitro fertilization, IVF. How IVF works. 1. Introduction. Welcome to our step-by-step guide to in vitro fertilization, or IVF, the groundbreaking process that's helped countless families realize their dreams of parenthood. 2. Step 1. Fertility medications. The journey begins with fertility medications, typically administered as shots. These medications stimulate your ovaries to produce multiple mature eggs. The goal: to harvest 10-15 eggs, a process that typically takes about 2 weeks until your eggs are ready for retrieval. 3. Step 2. Egg retrieval. Next up is the egg retrieval process, a brief procedure lasting 15 to 30 minutes. During retrieval, a doctor utilizes ultrasound guidance to insert a thin, hollow tube through your vagina and into the ovary containing the eggs. A suction device connected to a needle gently retrieves the eggs from each follicle. 4. Step 3. Fertilization. Now, it's time for fertilization, a critical stage in the IVF process. In traditional IVF, eggs and sperm are left in a laboratory dish to fertilize naturally. Alternatively, in intracytoplasmic sperm injection, ICSI, a single sperm is directly injected into the egg for fertilization. This method bypasses natural barriers, increasing the likelihood of successful fertilization. 5. Step 4. Embryo development. Once fertilization occurs, the embryo begins to divide its cells, eventually reaching the blastocyst stage, 5-6 days post-fertilization. At this stage, multiple embryos are carefully selected for transfer back into your uterus. 6. Step 5. Embryo transfer. The final step, embryo transfer. Multiple embryos are transferred back into your uterus with the hope that at least one will successfully implant and begin to develop. 7. Conclusion. And there you have it, a comprehensive overview of the IVF process, from fertility medications to embryo transfer. If you're considering IVF or simply curious about the procedure, don't hesitate to reach out to a qualified fertility specialist. Thanks for joining us, and we wish you all the best on your journey to parenthood.
Hello everyone. Welcome to this week's video about pregnancy symptoms and baby development at 27 weeks. At this point in your pregnancy, you're already well into your second trimester, and your baby is continuing to grow and develop at an incredible pace. Let's start by talking about some of the common pregnancy symptoms you may be experiencing. One of the most noticeable changes may be the size and shape of your belly, which is likely to be much larger now than it was just a few weeks ago. You may also be experiencing some swelling in your feet and ankles, as well as back pain and discomfort as your baby continues to put pressure on your spine and pelvic area. Other common symptoms at this stage of pregnancy can include indigestion, heartburn, and constipation, as well as increased fatigue and difficulty sleeping. It's important to continue to take care of yourself during this time by eating a healthy diet, staying hydrated, and getting plenty of rest whenever possible. Now, let's talk about your baby's development at 27 weeks. At this stage, your baby is approximately 14.8 inches long and weighs around 2 pounds. Their eyes are now fully formed, and they are able to blink and open and close their eyes. They are also developing their sense of hearing and may be able to recognize your voice and other familiar sounds. Your baby's lungs are continuing to develop, and they may even be practicing breathing movements in preparation for their arrival into the world. They are also beginning to store up fat, which will help to keep them warm after they are born. Another important development at this stage is the development of your baby's brain. As your baby's brain continues to grow and develop, they may begin to exhibit more complex behaviors and movements, such as grabbing onto the umbilical cord or sucking their thumb. As your due date approaches, it's important to begin thinking about your birth plan and discussing your options with your healthcare provider. This may include deciding on whether or not to use pain medication during labor, as well as considering different birthing positions and other options that can help you to have a safe and comfortable delivery. In addition to preparing for your delivery, it's also a good idea to begin thinking about your postpartum care and support. This may include arranging for help with childcare and household tasks, as well as seeking out resources for emotional support and counseling. As always, if you have any questions or concerns about your pregnancy, it's important to talk to your healthcare provider for advice and guidance. So that's it for this week's video on pregnancy symptoms and baby development at 27 weeks. Thanks for tuning in, and we'll see you in next video. Hello everyone, and welcome back to our pregnancy journey. Today, we are at the 28-week mark, which means we are officially in the third trimester. In this video, we will discuss the symptoms you may experience at this stage of pregnancy and how your baby is developing. First, let's symptoms you may experience during the 28th week of pregnancy. At this point, your baby is growing rapidly, which can put a lot of strain on your body. You may feel more tired than usual, and you may also experience shortness of breath as your growing baby puts pressure on your lungs. You may also experience swelling in your hands, feet, and ankles as your body retains more fluid. This is normal, but if you notice severe swelling, be sure to speak with your healthcare provider as it can be a sign of preeclampsia, a serious pregnancy complication. Heartburn and indigestion are also common during the third trimester as your growing uterus puts pressure on your stomach, leading to acid reflux. Eating small, frequent meals and avoiding spicy or acidic foods can help alleviate these symptoms. Now let's talk about your baby's development at 28 weeks. At this stage, your baby weighs around 2.5 pounds and is approximately 15 inches long. Their brain is developing rapidly, and they can now blink their eyes, which have formed fully. Your baby's lungs are also developing, and although they are not yet fully functional, they are producing surfactant, a substance that helps the lungs expand and contract. This is an important milestone in your baby's development as it prepares them for life outside the womb. Your baby's senses are also developing at this stage, and they can now hear your voice and your heartbeat. You may notice that your baby becomes more active when you talk or sing to them. As your baby continues to grow, they will start to gain more fat, which will help regulate their body temperature after birth. They will also continue to practice breathing, and by the end of the third trimester, they will be able to hiccup. So, what can you expect during the rest of the third trimester? As your due date approaches, you may experience more intense Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. You may also notice an increase in vaginal discharge, which is normal but should not have a strong odor or be accompanied by itching or burning. It is also important to start preparing for labor and delivery. Talk with your healthcare provider about your birth plan and attend childbirth education classes to learn about the different stages of labor and coping techniques for pain. In summary, at 28 weeks pregnant, you may experience symptoms such as fatigue, shortness of breath, and swelling. Your baby is rapidly growing and developing, and they can now hear your voice and blink their eyes. As you move into the third trimester, be sure to continue monitoring your symptoms and preparing for labor and delivery. That's all for today's video. Thank you for watching, and be sure to subscribe to our channel for more pregnancy updates.
Hello, and welcome back to our... Today we're going to talk about the 29th week of pregnancy and what you can expect for both your baby's development and your own body changes. Let's start with your baby. At this point, your little one is roughly the size of a butternut squash, weighing in at around 2.5 pounds and measuring about 15 inches long from head to toe. Your baby's brain is continuing to develop rapidly, and their lungs are starting to produce surfactant, a substance that helps them breathe on their own outside of the womb. Your baby's movements are becoming more pronounced, and you may start to notice a pattern of when they are most active. They are also starting to develop their sense irregular, but if you're experiencing discomfort, it's important to let your healthcare provider know. Other common symptoms at this stage of pregnancy include shortness of breath, heartburn, and difficulty sleeping. If you're having trouble sleeping, try sleeping on your left knees to support your lower back and hips need for your baby's arrival. This includes things like a car seat, crib, diapers, and clothing. Overall, the 29th week of pregnancy is an exciting time as your baby continues to grow and develop. As always, if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Thank you for tuning in, and we'll see you next time for another update on your pregnancy journey. Hello, and welcome to this video about 30 weeks of pregnancy and baby development. This is an exciting time for both the mother and baby as there are many changes happening. In this video, we will discuss the baby's development, the mother's physical changes, and how to take care of yourself during this period. Baby development. At 30 weeks of pregnancy, the baby is the size of a cucumber and weighs around 3 pounds. Here are some key developments happening at this stage. Brain development. The baby's brain is growing rapidly, and the cerebral cortex is developing, which is responsible for controlling movement, sensation, and perception. Lung development. The lungs are almost fully developed, and the baby is practicing breathing movements, which will help them breathe on their own after birth. Fat deposits. The baby is accumulating fat deposits under the skin, which will help regulate their body temperature and provide energy after birth. Sensory development. The baby's senses are becoming more refined, and they can recognize sounds, light, and even taste. Movement. The baby is quite active and can move around, kick, and even hiccup. You may feel their movements quite strongly at this stage. Mother's physical changes. As the baby grows, the mother's body will also go through many changes. Here are some of the most common physical changes at 30 weeks. Weight gain. Most women will have gained around 20 to 25 pounds by this stage of pregnancy. The weight gain is essential for the baby's growth and development. Braxton Hicks contractions. These are mild contractions that may be felt in the uterus. They are not usually painful and are a sign that the uterus is preparing for labor. Stretch marks. The skin around the abdomen may begin to stretch, causing stretch marks. These usually fade after pregnancy. Fatigue. As the baby grows, the mother may feel more tired and require more rest. Shortness of breath. The growing baby can put pressure on the diaphragm, making it harder to breathe deeply. Taking care of yourself. It's essential to take care of yourself during pregnancy to ensure both you and your baby stay healthy. Here are some tips for staying healthy during the 30th week of pregnancy. Eat a healthy diet. Make sure you are eating a balanced diet that includes plenty of fruits, vegetables, and lean protein. Avoid foods that are high in sugar or fat. Stay active. Regular exercise can help you feel better and reduce stress. Walking, swimming, and prenatal yoga are all good options. Conclusion. At 30 weeks of pregnancy, the baby is growing rapidly, and the mother's body is going through many changes. It's essential to take care of yourself and attend regular prenatal checkups to ensure both you and your baby stay healthy. Remember to eat a healthy diet, stay active, get plenty of rest, and drink plenty of water. Thank you for watching, and we wish you a healthy and happy pregnancy. Hello, and welcome back to our series on pregnancy. Today, we will be discussing week 31 of pregnancy and everything you need to know about your baby's development and your symptoms. So, let's get started. Baby development. At week 31, your baby is approximately 16, weighs around 3.5 pounds. Here are some of the key developments happening to your baby during this time. Rapid brain growth. Your baby's brain is growing rapidly during this time, which means that they will be able to process information more efficiently. Lung development. Your baby's lungs are almost fully developed at this point, and they are practicing their breathing movements. Sleep cycles. Your baby is now starting to have regular sleep and wake cycles. Baby fat. Your baby is putting on more baby fat, which helps regulate their body temperature after birth. Symptoms. As you enter the final trimester of your pregnancy, you may experience some new symptoms or the worsening of old ones. Here are some of the common symptoms that you may experience at week 31. Braxton Hicks contractions. You may start to experience Braxton Hicks contractions, which are mild contractions that help prepare your body for labor. Shortness of breath. As your uterus grows and pushes against your diaphragm, you may experience shortness of breath. Back pain. As your baby grows, the weight can put pressure on your back, causing discomfort. Swelling. You may experience swelling in your feet, ankles, and hands due to the increased fluid in your body. Heartburn. As your uterus grows, it can put pressure on your stomach, causing acid reflux and heartburn. Fatigue. As your body works hard to support your growing baby, you may feel more tired than usual. Frequent urination. Your baby's position may put pressure on your bladder, causing you to urinate more frequently. Tips for a healthy pregnancy. Eat a healthy diet. Make sure to eat a well-balanced diet that includes plenty of fruits, vegetables, whole grains, and lean proteins. Stay hydrated, drink plenty of water and other fluids throughout the day to stay hydrated. Exercise, gentle exercise, such as walking or swimming, can help relieve some of your pregnancy symptoms and prepare your body for labor. Attend prenatal appointments. Regular prenatal appointments with your healthcare provider are essential to monitor your baby's growth and ensure a healthy pregnancy. Take childbirth classes. Childbirth classes can help prepare you and your partner for labor and delivery. Conclusion: at week 31 of pregnancy, your baby is continuing to grow and develop rapidly. You may experience some new symptoms or the worsening of old ones, but there are steps you can take to stay healthy and comfortable during this time. Remember to eat a healthy diet, stay hydrated, exercise, get plenty of rest, attend prenatal appointments, take childbirth classes, and practice relaxation techniques. With these tips, you can have a healthy and happy pregnancy. Thanks for tuning in, and we'll see you next time. Hello everyone, welcome to my YouTube channel. Today we will be discussing 32 weeks pregnancy and baby development, symptoms, tips, and healthcare. As a senior gynecologist, I have had years of experience helping women through their pregnancy journey. So, without further ado, let's get started. Baby development. At 32 weeks, your baby is about the size of a large jicama, measuring around 16.7 inches long and weighing about 4 pounds. Your baby's eyes are now fully formed and can open and close them. The bones in your baby's skull are not yet fused, which allows for easier passage through the birth canal during delivery. Your baby's immune system is starting to develop, and they are producing white blood cells to help fight off infections. Your baby's lungs are also continuing to develop and produce surfactant, a substance that helps keep the air sacs in the lungs from sticking together. Symptoms. At 32 weeks, you may experience increased back pain and discomfort as your baby continues to grow and put pressure on your back and pelvis. You may also experience increased fatigue and difficulty sleeping due to the physical strain of pregnancy. Braxton Hicks contractions, or practice contractions, may become more frequent as your body prepares for labor. Heartburn and indigestion may also become more common as your baby continues to push up on your stomach. Swelling in your feet and ankles may become more pronounced as your body retains more fluids. Tips. To help alleviate back pain, try using a pregnancy pillow to support your belly and lower back while sleeping. Practice good posture and avoid standing or sitting in the same position for too long to help prevent back pain and swelling. Stay hydrated and try to keep your feet elevated as much as possible to reduce swelling. To help manage heartburn and indigestion, try eating smaller, more frequent meals and avoid foods that trigger symptoms. Make sure to stay active and get regular exercise, such as walking or prenatal yoga, to help maintain your overall health and prepare your body for labor. Healthcare. At 32 weeks, you will typically have a prenatal visit with your healthcare provider to check on your baby's growth and development. Your healthcare provider may also perform a Group B Streptococcus (GBS) test to check for the presence of bacteria that can be harmful to your baby during delivery. It is important to continue taking any prescribed prenatal vitamins and medications as directed by your healthcare provider. In conclusion, 32 weeks is an important milestone in your pregnancy journey. Your baby is continuing to develop and grow, and you may experience new symptoms and challenges. Remember to practice good self-care, stay active, and attend all scheduled prenatal appointments to ensure a healthy pregnancy and delivery. Thank you for watching, and I'll see you in the next video. Hello everyone. Today, we will talk about the 33 week of pregnancy and the development of the baby at this stage. We will also discuss some common symptoms that mothers experience during this period and tips for taking care of their health. Baby development. At 33 weeks, the baby is about 17 inches long and weighs around 4 pounds. The baby's lungs are still developing and producing surfactant, a substance that helps the lungs expand and contract properly after birth. The baby's brain is rapidly developing, and they can now sense light and dark. The baby's bones are hardening, and they are gaining more fat under their skin, which will help regulate their body temperature after birth. The baby's movements are becoming more coordinated, and they can respond to sound. Symptoms. Braxton Hicks contractions. These are practice contractions that help prepare the uterus for labor. They can be uncomfortable, but are usually not painful. Backaches. As the uterus expands, it puts pressure on the lower back, causing discomfort. Shortness of breath. The growing uterus can also put pressure on the diaphragm, making it harder to breathe. Fatigue. As the body works harder to support the growing baby, mothers may feel more tired than usual. Swelling. The body retains more water during pregnancy, causing swelling in the feet, ankles, and hands. Tips for health care. Continue to eat a healthy and balanced diet, including plenty of fruits, vegetables, and protein. Stay hydrated by drinking plenty of water and avoiding sugary or caffeinated beverages. Exercise regularly, but avoid strenuous activities that could put too much strain on the body. Sleep on your side, preferably the left side, to improve blood flow to the baby and reduce the risk of stillbirth. Attend all prenatal appointments and communicate any concerns with your healthcare provider. Preparing for birth. Start thinking about a birth plan, including preferences for pain management and delivery options. Consider taking childbirth classes to learn about the labor process and techniques for coping with pain. Pack a hospital bag with essentials for both mother and baby, including clothing, toiletries, and a car seat. Talk to your healthcare provider about the signs of labor and when to call or go to the hospital. Conclusion. As you approach the end of your pregnancy journey, it is important to take care of yourself and your growing baby. Remember to listen to your body, attend all prenatal appointments, and communicate any concerns with your healthcare provider. By taking these steps, you can help ensure a healthy and safe delivery for both you and your baby. Thank you for watching, and I wish you all the best in your pregnancy journey. Hello everyone, we are going to discuss pregnancy at 34 weeks. At this stage, your baby is approximately 18 inches long and weighs around 4.5 pounds. Your baby's organs are fully developed, and they are continuing to gain weight and grow. Braxton Hicks contractions. These are practice contractions that your body goes through as it prepares for labor. They can be uncomfortable, but are usually not painful. Shortness of breath. As your baby continues to grow, it can push against your diaphragm and make it harder to breathe. You may notice that you need to take more frequent breaks or rest periods. As your baby moves into the birth canal, you may experience discomfort or pain in your pelvic area. Swelling. Many women experience swelling in their feet and ankles during pregnancy. Make sure to elevate your feet when possible and stay hydrated. Gestational diabetes. This is a type of diabetes that develops during pregnancy. If you are diagnosed with gestational diabetes, your doctor may recommend a special diet and monitoring your blood sugar levels. Preeclampsia. This is a potentially serious condition that can develop during pregnancy, characterized by high blood pressure and protein in the urine. If you experience symptoms like severe headaches, vision changes, or abdominal pain, contact your doctor immediately. Fetal movement. You should continue to monitor your baby's movements and contact your doctor if you notice any significant changes. Now, let's talk about some tips for taking care of yourself during this stage of pregnancy. Rest. As your due date approaches, make sure to get plenty of rest and sleep. This will help you conserve your energy for labor and delivery. Stay hydrated. Drink plenty of water and avoid sugary or caffeinated drinks. Exercise. Gentle exercise like walking or prenatal yoga can help you stay healthy and prepare your body for labor. Kegel exercises. These exercises can help strengthen your pelvic floor muscles and prepare your body for childbirth. Prenatal classes. Consider taking a prenatal class to learn more about childbirth, breastfeeding, and newborn care. Pack your hospital bag. Start packing your hospital bag with essentials like clothes for you and your baby, toiletries, and important documents. Talk to your doctor. Make sure to keep your doctor updated on any symptoms or concerns you may have. Finally, let's talk about your baby's development at 34 weeks. Baby's lungs. Your baby's lungs are almost fully developed, and they are practicing breathing movements in preparation for birth. Body fat. Your baby is continuing to gain weight and develop body fat, which will help regulate their body temperature after birth. Sleep and wake cycles. Your baby may start to have regular sleep and wake cycles, which can help prepare them for life outside the womb. Head down position. Most babies will move into the head down position in preparation for delivery. Overall, pregnancy at 34 weeks is an exciting and important time as you prepare for the birth of your baby. Remember to take care of yourself and stay in touch with your doctor as you get closer to your due date. Thanks for watching, and I'll see you in the next video. "35 weeks pregnancy. Baby development and symptoms." Welcome back to our channel, where we explore the incredible journey of pregnancy. Today, we're going to dive into the exciting world of 35 weeks of pregnancy. At this stage, your baby is rapidly developing, and you may be experiencing various symptoms. So let's get started. Baby's development. Your baby now weighs around 5.5 to 6 pounds and measures about 18 inches from head to toe. The baby's organs and systems are nearly fully developed, and the lungs continue to mature. The skin is becoming smoother as the fat layers continue to fill out. Your baby's brain is rapidly growing, and the nervous system is maturing. The baby's bones are fully formed but are still flexible to ease the birthing process. Symptoms you may experience. Braxton Hicks contractions. You may experience more frequent and intense practice contractions, which can help prepare your body for labor. Shortness of breath. As your uterus expands, it pushes against your diaphragm, making it harder to take deep breaths. Increased vaginal discharge. It's common to have a thicker and heavier discharge at this stage, but consult your doctor if it's accompanied by itching, burning, or a foul odor. Pelvic discomfort. The growing baby puts pressure on your pelvis, leading to pelvic pain or discomfort. Frequent urination. The baby's position and size may put pressure on your bladder, causing the need to urinate more often. Trouble sleeping. Finding a comfortable position becomes more challenging, and you may experience pregnancy-induced insomnia. Heartburn and indigestion. Hormonal changes and the baby's position can lead to increased acidity and digestive issues. Self-care tips for this stage. Rest and sleep. Listen to your body and prioritize getting enough rest and sleep. Exercise. Engage in gentle exercises like walking or prenatal yoga to stay active and relieve discomfort. Pelvic floor exercises. Strengthen your pelvic floor muscles by practicing Kegel exercises. Maintain a healthy diet. Focus on well-balanced meals that include fruits, vegetables, lean proteins, and whole grains. Stay hydrated. Drink plenty of water throughout the day to prevent dehydration and assist with digestion. Use proper body support. Invest in a maternity support belt or pillow to help alleviate back and pelvic pain. Practice relaxation techniques. Deep breathing exercises, meditation, or prenatal massages can help reduce stress and promote relaxation. Prepare for breastfeeding. Attend breastfeeding classes, educate yourself about proper latch techniques, and gather essential supplies. And that wraps up our exploration of 35 weeks of pregnancy. Remember, every pregnancy is unique, and if you have any concerns or questions, consult your healthcare provider. Stay tuned for more exciting updates on the journey of pregnancy. Don't forget to like, subscribe, and hit that notification bell to never miss an episode. Take care, and we'll see you next time. Greetings, and welcome back to our Pregnancy Journey series. Today, we're diving into the incredible journey of the 36th week of pregnancy. As your due date gets closer, both you and your baby are experiencing some remarkable changes. Let's explore the symptoms you may encounter and the exciting developments happening to your little one. Maternal symptoms at 36 weeks. Increased discomfort. Your baby's growth puts additional pressure on your abdomen, causing discomfort and backaches. Frequent urination may persist as your baby continues to press on your bladder. Shortness of breath can occur due to limited space for your lungs. Braxton Hicks contractions. These contractions, also known as practice contractions, become more noticeable and frequent. They help prepare your body for labor, but they are usually irregular and mild. Swollen feet and ankles. Fluid retention can cause swelling in your feet and ankles. Elevating your legs and wearing comfortable shoes can help alleviate this symptom. Nesting instinct. Many women experience a strong urge to prepare their homes for the baby's arrival. This may involve cleaning, organizing, and setting up the nursery. Insomnia and fatigue. Discomfort, frequent bathroom trips, and hormonal changes can disrupt your sleep. Take short naps, practice relaxation techniques, and maintain a consistent sleep routine. Baby development at 36 weeks. Size and weight. Your baby is approximately 18 inches long and weighs around 6 pounds. Although still almost fully developed. Fetal position. Most babies settle into the head-down position, preparing for birth. The head engages into the pelvis, which is a sign that labor might be approaching. Lung development. 36 weeks, your baby's lungs have matured significantly. They continue to produce surfactant, a substance that helps the lungs expand and function properly after birth. Immune system. Your baby's immune system strengthens as they receive antibodies from you through the placenta. This provides them with some protection against infections early in life. Brain and nervous system. The brain development is almost complete, with rapid growth in the cerebral cortex. Your baby's nervous system is fully functional, and they can process information and regulate body temperature. Baby's movement. Due to limited space, you may feel more rolling and stretching movements instead of kicks. Hiccups are common as your baby practices swallowing and inhaling amniotic fluid. Preparations for the upcoming weeks. Finalize birth plan. Discuss your birth preferences with your healthcare provider and ensure they are included in your birth plan. Pack your hospital bag. As your essentials for you and your baby. Include comfortable clothing, toiletries, nursing bras, baby clothes, diapers, and important documents. Attend childbirth classes. Join childbirth education classes to learn about labor, pain management, and relaxation techniques. Discuss breastfeeding. Talk to your healthcare provider or a lactation consultant about breastfeeding techniques and potential challenges. Hello and welcome back to our pregnancy journey. Today, we're diving into the incredible journey of week 37 of pregnancy. As we approach the final stretch, both you and your baby are going through significant changes. So, let us explore the symptoms and developments you can expect during this exciting time. But before we begin, don't forget to hit that subscribe button and ring the notification bell, so you don't miss any of our future videos. Week 37 marks the beginning of the 9th month of pregnancy, and your baby is almost ready to make their grand entrance into the world. Let us start by taking a look at the baby's development. At this stage, your baby weighs around 6.5 pounds 2.9 kilograms and measures approximately 19 inches 48 centimeters long. They are fully developed and are fine-tuning their systems for life outside the womb. Their organs, including the lungs, digestive system, and immune system, are all working in unison, preparing for the transition. Now, let us discuss the symptoms and changes you may experience during week 37. Increased pressure and discomfort. Host, as your baby continues to grow, you may experience increased pressure and discomfort in your pelvic region. This happens as your baby's head descends into the pelvis, preparing for birth. This can lead to a frequent need to urinate, difficulty walking, and even back pain. Braxton Hicks contractions. Host, you may also notice an increase in Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. These contractions are usually irregular and less painful than true labor contractions. Remember to stay hydrated and practice relaxation techniques to ease any discomfort. Fatigue and difficulty sleeping. Host, fatigue and difficulty sleeping can become more prominent during week 37. Your growing belly, frequent bathroom trips, and discomfort can make it challenging to find a comfortable position. Try using pillows for support and establishing a relaxing bedtime routine to improve your sleep. Increased vaginal discharge. Host, during this stage, you might notice an increase in vaginal discharge. This discharge, known as leukorrhea, helps prevent infections. However, if you experience any changes in color, consistency, or a foul odor, it's essential to consult your healthcare provider. Swelling and varicose veins. Host, swelling, especially in the feet and ankles, can become more pronounced at this stage of pregnancy. Additionally, you might notice the appearance of varicose veins due to increased blood volume and pressure. Elevating your legs, wearing compression stockings, and taking regular walks can help alleviate these symptoms. Emotional changes. Host, lastly, as your due date approaches, you might experience a mix of emotions, including excitement, nervousness, and even anxiety. It's essential to surround yourself with a support system and communicate your feelings with your loved ones. And that wraps up our journey through week 37 of pregnancy. It's amazing to see how far both you and your baby have come. Remember, each pregnancy is unique, so if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Stay tuned for our next video, where we'll discuss the final stages of pregnancy and the upcoming labor and delivery. Don't forget to like this video and leave a comment below if you found this information helpful. Until next time, take care and enjoy the remaining weeks of your pregnancy journey. Thank you for watching, and we'll see you soon. And welcome back to our YouTube channel, where we discuss all things pregnancy and baby related. Today, we're diving into the fascinating world of 38 weeks of pregnancy. So, let us get started. Baby's size and weight. At 38 weeks, your baby is approximately the size of a pumpkin, measuring around 19 to 21 inches 48 to 53 centimeters and weighing about 6 to 7 pounds 2.7 to 3.2 kilograms. Your little one has been growing and developing rapidly throughout the pregnancy journey. Organ development. By this stage, your baby's organs, including the lungs, digestive system, and immune system, are almost fully developed. These organs have been maturing over the past several weeks, preparing your baby for life outside the womb. Baby's position. Most babies settle into a head-down position in the uterus by 38 weeks. This is known as the vertex or cephalic presentation, which is the ideal position for a vaginal delivery. However, if your baby is not in the head-down position, your healthcare provider may discuss options for encouraging the baby to turn. Braxton Hicks contractions. You may be experiencing Braxton Hicks contractions more frequently now. These practice contractions feel like a tightening of the abdomen and are a way for your body to prepare for labor. If the contractions become regular, intense, or are accompanied by other signs of labor, it's important to contact your healthcare provider. Pelvic discomfort. At this stage, you may experience increased pelvic pressure and discomfort. Your baby's Fatigue and difficulty sleeping. As your belly grows bigger, it can become challenging to find a comfortable sleeping position. You may also experience frequent bathroom trips during the night. Combined with anticipation and hormonal changes, this can lead to fatigue. It's important to rest as much as possible and practice relaxation techniques. Many expectant mothers experience a surge in energy and the desire to prepare their home for the baby during the final weeks of pregnancy. This is often referred to as the nesting instinct. It's a natural urge to clean, organize, and make sure everything is ready for the arrival of your little one. Emotional changes. With the due date approaching, it's common to feel a mix of excitement, anxiety, and a range of other emotions. The hormonal fluctuations can contribute to mood swings as well. Remember to communicate with your partner and support system, and don't hesitate to seek professional help if you're feeling overwhelmed. Hospital bag and birth plan. Now is the time to make sure your hospital bag is packed and ready to go. Include essentials like comfortable clothes, toiletries, and items for the baby. It's also